I think it's time we talk about the true elephant in the room and talk about the culprits and further causes for what contributes to autism and other neurodegenerative diseases, because what we see clinically is starting to startle myself as a practitioner, because we're seeing little ones at such a young age come into our office and their standard practitioners have no idea on how to support them further. So first you have to understand that the blood-brain barrier is very permeable until around the age of 7. So then when you consider that the most toxic chemicals that contribute to autism that they've seen in their research time and time again and other neurodegenerative diseases include mercury, lead, formaldehyde, and especially aluminum. And then you have to understand, until about the age of 6 to 7, what's being recommended to our little ones. If you're going to standard pediatricians, you're being recommended multiple shots. Now, what are in these shots, may you ask? Well, there's a few that are given to protect against sexually transmitted diseases. That's a video for a whole nother day. But then you look at something like the DTaP shot, and you're getting around 5 shots minimum by the age of 6. Now, what are the ingredients in the DTaP immunization, may you ask? Where you're going to find formaldehyde, aluminum hydroxide, polysorbate 80. Now, polysorbate 80, you also have to understand that this makes that blood-brain barrier even more permeable, meaning the influx of further toxins, whether they're from our environment, nutrition, or direct injection, can cross that blood-brain barrier way easier. Now, mind you, there are no arguments against understanding that these are chemicals and neurotoxins that can cause some serious damage. And inevitably, you need enough glutathione production if you want a chance against fighting against heavy metals. Now, then you have to consider, what are they giving our little ones before certain immunizations? They're giving Tylenol, which you have to remember that Tylenol significantly reduces your glutathione production even further. And all little ones with autism and other issues there have a very poor function and production of glutathione. So without making any judgments, you decide what is best for your little ones, especially when you're going into that practitioner's office. And I'm shouting about this, I'm making a video about this because I've seen too many little ones and their mamas and their families struggle with further issues, and their doctors are not connecting the dots for them. So what we've seen clinically, after we're finally assessing a GI analysis on the little one, we're seeing how immune compromised they really are, how much toxins are overloading their system, their nervous system, how their liver is functioning, so that we can help them get through a detox gently, slowly, without further adding more chemicals. Comment down below if you have any questions, thoughts about this. We would love to hear back what you guys think and what your experience has been like, especially in the realm of autism and other neurodegenerative issues.